I'm just gonna quickly review our coagulation medications and coagulation medications and why we're using them real quickly. It's about 2 pages. There's some meds that I have not included, but I will go over them if you send me an email after watching this video, and I can just tag in and send you guys something back explaining. So, anticoagulants. Anticoagulants, the primary thing that they do is prevent clotting. So let's look here, prevent clotting because they inhibit antithrombin. So all of your coagulation medications, they're going to be inhibiting something in the blood that is causing the blood to thin, right? Blood thinners stop clotting, and clotting is caused by this, and this factor. So remember, anticoagulants are stopping antithrombin, okay? They inhibit antithrombin. Your coagulation medications are heparin and enoxaparin. Heparin is your normal one, and enoxaparin is your low molecular weight heparin. This is basically just a longer acting heparin, which is why I don't have much written underneath here, okay? Your major problem is with heparin, you can have heparin toxicity. We talked about it in class. Heparin toxicity, you're treating it with protamine sulfate. If you're looking at your therapeutic times, you take 1.5 to 2, and then you multiply by whatever your APTT time is, okay? APTT is the lab value that you're going to use to monitor heparin. So any patient that's getting heparin, you're monitoring their APTT. What are complications? You're giving them a blood thinner. Obviously, their risk for bleeding is going to go high up. We've also have the risk for heparin-induced thrombocytopenia. Heparin-induced thrombocytopenia means basically their platelet levels are low and their thrombi in their blood is high. So what does that mean? Their platelets, the factor that causes clotting, is so low that the blood is so thin that you have too many of these small clots that build up, and then they spread out to the body, and these can spread out. They can end up in your lungs, brain, end of your like in your fingers, in arteries. You just get a bunch of clots that form everywhere. First thing you're going to want to do is immediately stop the heparin, and then you have to monitor their platelet count, stuff like that. I'm not going into detail, it's not relevant here. Low molecular weight heparin, which is the enoxaparin that I said earlier. You were using it to treat DVTs, PEs, and STEMIs. For those of you that don't know what a STEMI is, this is what like a normal EKG should look like. There should be a little hump here as well. Sorry. In a STEMI, what you have is, so this is called P. This is your QRS, and this is your T wave. You have your P wave, you have your drop down QR, and then you have an S, and then your T wave comes down like this, okay? This is what an ST elevation is going to look like. That is what that means. That means you're having a heart attack. Interactions. Any medication that you're taking for bleeding, any blood thinner will immediately have problems with any medication that is causing your bleeding to go up. So aspirin is one. NSAIDs, all your NSAIDs. This is like your ibuprofen. There's some more in there that I don't remember at the moment. Ginger, garlic, saw palmetto, some antibiotics. All of these medications, they increase your bleeding time, so you wanted to monitor for bleeding. So this is going to be bloody stools, bleeding in the urine. You're gonna want to tell the patients, hey, if you bump into something, make sure you're not bruising up too bad. If the bruising looks like it's getting worse, come in. You might be internally bleeding. You might not know. That's all you need to know about your anticoagulants. Next, vitamin K. Vitamin K inhibitor, which is warfarin. So vitamin K is the natural vitamin that is your clotting cascade. If you don't have enough vitamin K, your blood is too thin. If you have too much vitamin K, your blood is going to get thick, which is why we have that balance, right? So obviously, if your vitamin K inhibitor is warfarin, and you don't have enough vitamin K, and your blood is too thin, to treat it, we're going to give you vitamin K. So your treatment for warfarin is vitamin K. What is your complication? The same as the other one. You have a risk for bleeding. Why? Because we gave you a blood thinner. You have hepatitis. So with your liver, your liver is what is creating a majority of your clotting cascades, right? Your liver is what's working with your blood cells. If your liver is damaged, your clotting cascades are off. So you can have hepatitis, which is infection or inflammation of the liver. Contraindications. For pregnant women, don't breastfeed. If you have had a neurological, or you've had a lumbar, or you've had something doing with your spine, any sort of surgery like that, you're going to want to watch out because your bleeding time might be way too high. You're also going to probably want to stop this before you go into surgery. Interactions, as I said earlier, saw palmetto is going to be a pretty good interaction that you can review. Aspirin, NSAIDs, ginger, garlic, some antibiotics. I won't go into the specifics of that. You guys can look it up. You guys will be okay. Factor X. I don't know necessarily if you need to know about Factor X, but Factor X, a direct factor, XA, it's another clotting cascade. So Factor X is something, is a clotting cascade, and this is acting against Factor X, this drug called rivaroxaban. It does the same thing as the other stuff, but instead of people that are having clotting problems because of their platelets or something, they're having problems with Factor X, we're giving this to them, okay? Complications, bleeding, liver problems, don't mix with other drugs, monitor for bleeding. I'm not going into detail about that. And then we'll end up finally at antiplatelets. Antiplatelets, what they do is they stop platelets from aggregating. They stop platelets from clumping together to stop bleeding, right? So what are your big ones? You have aspirin. We talked about, I'm not even going to attempt to pronounce that, the ABC one, and then you have clopidogrel. Aspirin is oral. The one with the weird name, abixabam, is IV, and clopidogrel is another oral medication. Okay. Complications: aspirin bleeding, the weird name bleeding, clopidogrel bleeding. All of them bleeding. Okay. Next one, aspirin. Since it can be classified under NSAID, quote unquote, you're going to have problems with GI upset. So monitor for any upset stomach, nausea, vomiting. Tinnitus, anything that is an NSAID has a risk for causing tinnitus. So if they have ringing in the ear, they need to notify you, okay? With this one with the weird name, we're monitoring their heart rate and their blood pressure because they have a chance at hypotension and bradycardia. Check their vitals. If it seems like they're trending down on either one of these things, let's try and talk to the doctor, especially if it's a new medication that they're getting. Clopidogrel, same thing, bleeding. You're going to have some GI discomfort, dyspepsia, diarrhea, pain, and then sometimes vomiting as well. For all of these, the contraindications obviously is going to be surgery, pregnant women, anyone that has any sort of liver or kidney problems. I'm trying to see if there's anything specific. Aspirin, I would highly, we're going to want to don't use in kids post viral infection. So aspirin is classified as a salicylate, an ASA, and if you give aspirin to a kid post viral infection, they can have this thing called Ray's syndrome, which is very deadly. They might pop up on your exam, not on this one, maybe on the next one, but just in case, you need to know. Yeah. Also, there's one medication that I haven't written down here. Real quickly, I'll write it down. It is called Alteplase, and this is a thrombolytic. Thrombolytics, they break up clots. So this is break up clots. And the medication is called Alteplase. ALTEPLASE, Alteplase, right? So you have a clot that forms, this goes in, breaks it up, shoots it up, small pieces, body digests the rest of it. This is IV only. IV only. Risk factors: serious risk for bleeding. You can have bleeding from your catheter sites, internal in your brain, GI tract, all over. We're going to be monitoring their APT, TPT, hemoglobins, hematocrit. they might need a dose of fibrinol. They might have fibrinolysis following alteplase, so their clotting cascades are going to get messed up even more, possibly after giving this. So just monitor for that. If they're getting NSAIDs, any of the other medications that we mentioned before, be careful because their bleeding factors can go up. And that's pretty much the whole coagulation cascade that you need to know. Just remember, anticoagulants, they like heparin and enoxaparin, they act on antithrombin, so they stop clotting. Vitamin K, it inhibits vitamin K, and that's why your clotting is reduced. Factor X inhibits factor X. Antiplatelets work on platelets to stop aggregation. Thrombolytics work on breaking up clots. That's the big overarching idea. Hope you guys do okay on the exam. I'm going to record a couple more videos and send them out your way.